Children who live in poverty experience a double jeopardy. They're more likely to suffer poor health, and they're also more likely to suffer consequences, more severe consequences of that poor health compared to their well-to-do peers. And this has to do with aspects of a poor environment, inadequate housing, inadequate nutrition, a variety of stresses related to violence or not, and they really interact and combine with biologic vulnerabilities to cause illness or exacerbate illness. Doctors, unfortunately, we're limited in just the medical factors, so we need other types of interventions to combine with us to make a difference in the lives of children who are low income.
Project Health's Family Help Desk is a physical desk located in the clinic waiting room, staffed by college volunteers. And when a patient comes into the doctor's office for a visit and the physician or nurse identifies any unmet resource need, food, housing, childcare, fuel assistance, the physician can prescribe those resources for the patient using a physical prescription pad, which the family will then take to the desk in the waiting room, and our core of college volunteers will then do a more extensive intake with the family and connect that family out to the resources that they need to be healthy.
As soon as a patient leaves your office, what are they going to do with that prescription? They'll walk out of the door, and do they have the ability to actually read the prescription and the bottle that will have their new medication? Do they speak English, or do they speak another language that the prescription needs to be translated into? Do they have a means to get to the pharmacy to fill that prescription? Do they have the money to pay for that prescription, or what's their insurance status? Do they have food at home to take the medication so they don't suffer from the numerous side effects if you take it on an empty stomach? As physicians and as medical students and as healthcare professionals, many of us will simply write that prescription, but Project Health teaches you that you have to ask the numerous questions surrounding that piece of paper.
In a broader scope of things, we need to look at their housing and their food and their other issues such as daycare and jobs that affect the health and the well-being of these families. And that's where the Family Help Desk comes in, because they are outside of the clinic. They are not restricted by the time of my visit. They can sit with the families and advocate for the families and help them learn how to advocate for themselves.
Our volunteers are exceptional college students who bring great passion and tenacity to the work of ensuring that families are able to access community resources. And after they graduate from their work with Project Health, go on to a range of careers, many in medicine, but many in other fields. And in doing so, bring a distinct point of view about the way healthcare should be delivered in this country and how critical it is that the healthcare system be designed in a way that is responsive to the needs of vulnerable patients, and in particular low-income children and families.
I think all hospitals that serve low-income children would benefit from Project Health, because the undergraduates really provide opportunities to extend the care that any hospital can provide, and therefore the hospital is being the vehicle for better care for the low-income children who live in the communities that the hospital serves.